I want to welcome everyone to the Budget, Finance, and Investment Committee for May 9th, 2024. And before we start, I want to call on our Vice Chairman, Trey Gooch, to offer a prayer.
Mr. Chairman, Commissioners, as you may know, a good friend of ours, Dr. Jimmy Sullivan's son, Asher, is in a very bad shape at Vanderbilt's Children's Hospital. And tonight we're going to dedicate this prayer to him, and I have a copy of a prayer that was published just for him, and we'll start with that. Let's go to our Father in prayer. Dear Heavenly Father, please have compassion on Asher and heal him. Send out your word and heal Asher. Rescue him from the grave. May Asher praise you in his innermost being, knowing that you forgive all of his sins and heals all of his diseases. Heal Asher, Lord, and he will be healed. Save him, and he will be saved. May Asher enjoy good health, and may all go well with him. Cause Asher to keep your word in his heart, knowing that it will bring life and health to his whole body, and help Asher not to lose heart when he feels like he is outwardly wasting away. Renew him day by day. Look upon Asher and heal him, guide him and comfort him, creating praise on his lips. Give him peace wherever he goes, and let Asher take refuge in you and be glad. Let him sing for joy. Spread your protection over Asher, O Lord, that he may rejoice in you. Bring health and healing to Asher. Let him enjoy abundance, peace, and security. And cause Asher to revere your name. Be his son of righteousness, rising in his life with healing praise. And bring your peace to Asher's heart, because a heart of peace gives life to the body. Father, we do not know, and probably will never understand while we live on this earth, why bad things happen to good people. And so tonight, we are asking you to heal Asher's heart, renew his brain, and guide his spirit. And Father, you know that Jimmy and Casey are good and faithful servants. And we need more people like them, not fewer. And so we implore you to comfort them and heal their son. Father, you know this family and what all they're going through, and it's just too much. It's just too much. We ask this in all things through Jesus Christ. Amen.
Okay, first thing on our agenda is to approve our minutes, and I'll again call on our Vice Chairman.
Thank you, Mr. Chair. I have reviewed those minutes, found them to be in order. Motion to approve the minutes as presented.
Second.
I have a motion and a second. Any comments? All in favor signify by saying aye. Aye. Any opposed? Motion carries. Okay, do we have any public comments? Mark, no one signed up. Okay. So next on the agenda is our investment report.
Good evening, sir.
Good evening.
I'm Ted Beatty, Rutherford County trustee. Our regular rates, LGIP dropped 1 basis point, and I was a little surprised by that to 531. Our other kind of stayed the same, and then the market this month, as you may have kept up with, interest rates kind of picked up a little bit, especially the second, third week of the month. So we purchased some investments. We did a couple of CDs and some agencies, and we were able to lock in between a year and 2 years at between 515 and 550. So about where we're getting, but it locks it in a little longer if rates drop, and we kind of anticipate that may happen. So that just gives us a little protection going forward, and we'll kind of continue to do that as the market gives us opportunity. So that's my report, sir.
I have a motion to approve the report and a second. Commissioner Irving. Any further discussion? All in favor signify by saying aye. Aye. Any opposed? Motion carries. Thank you, Mr. Beatty.
Thank you.
Okay, Michael, fund condition report.
So this month, we have, due to mainly investment income, we have hit 100% of our general fund revenue budget, so that is good news. We have collected almost 97% of property taxes at this point, so that is also good news. And our county side of sales tax has rebounded a little bit and is almost right at breaking even. It is negative 0.07, and so that is rebounding a little bit. So we are happy with that. And then currently, our adequate facilities tax is continued to remain elevated, which is also good news for us. With us going into next year, maybe not getting as much. So with that, we're right on track where we should be at this time of year, and things look to be doing really well for this fiscal year.
Okay, you've heard the report. Any questions for the director? Not, I'll entertain a motion. Have a motion to approve.
Second.
Second. Any discussion?
Just a
Irving.
quick question. Do you have a projection in terms of, and there have been some discussion about the adequate facilities tax and the effect on the upcoming budget, things like that. Could you just kind of elaborate briefly for us on that effect and kind of where we go from here? I'd also be curious to know if anybody knows if the governor has signed it or not.
I am not aware if he's signed it or not. I have made a reduction to the budget in front of you, which we'll go over at the end of the meeting tonight. I have reduced the anticipated collection next year substantially on school facilities tax for both the debt service fund and both the educational capital projects fund to hopefully conservatively budget that without not getting the large portion of that revenue for next year.
Yeah, thank you. That's fine.
And I'll touch a little more on that, I think, when we get to the overview of the budget presentation tonight on the budget books that you should have in front of you.
That'll be great. Thank you.
Any further discussion? Not, all in favor signify by saying aye. Aye. Any opposed? Motion carries. Okay, next up is our risk management financial report.
Good evening. Ed Elam with Insurance and Risk Management. So the 264 fund for the calendar year 2024, revenue $1,775,113, expenses $2,364,390, revenue less expenses a negative $589,277. For the totals for the calendar year, $7,483,053 in revenue, $6,991,605 in expenditures, revenue less expenditures, a positive $491,448. And for the 23-24 fiscal year totals, revenue $18,803,981, expenses $18,330,244, revenue less expenses a positive $473,737. On the 266 fund, for the month of April 2024, for workers' comp, there was $257.16. For OJI, $69,803.32. And total for the month of April, $70,060.48. Year-to-date totals for workers' comp, $6,967.31. OJI, $565,922.44. And for the total for the year, $572,889.75. For the county attorney expenses for the month of April, you have $21,853.42. Mr. Chairman, that concludes my report.
Okay, you've heard the report. Any questions for Mr. Elam? Hearing none, I'll entertain a motion. A motion to approve. And a second. Any discussion? Hearing none, all in favor signify by saying aye. Aye. Any opposed? Motion carries.
Okay, so next we have the property casualty and liability renewal in front of you. And I gave a little bit of a sheet to show a little bit of coverage. I know when we did a opening last year, I think, when we were starting to give out some numbers of vehicles and things like that, that actually the coverage was, there was some people writing down, and I thought, well, I'll just kind of give you a cover page here to give you an idea of the changes. And for just, if you look at the first page, you'll see where building contents increased from $2 billion to almost $2.4 billion. You have buildings and contents. You have $132 million in contents. You have over 400 buildings in 134 locations. There were 4 buildings added from the County Commission. There was 4 buildings added: Las Casas, Walter Hill, Public Health and Safety. There was a building in Milton, I think, for a fire engine. That used to be a volunteer building. And then there was the 814 South Church, that's the Board of Ed building. In addition to that, there was a donation made to the Smyrna High School. I think it's a field house, and that building was also added to this year. You see where there's 885 vehicles. That's about a 3% additional increase for a total of $58 million value. And then the liability, we have 371 buses that we carry the liability on. So on the next page, you'll see what the recommendation from the insurance committee was for property insurance, casualty insurance, crime, cyber liability, dental, volunteer accident coverage, and OJI surety bond. You can see last year's expiring premiums, $4,167,470. To the increase in the premium is $5,167,982. And that was presented to the insurance committee, was what the recommendation was. Third page, you can see all the ones that either there was, when the bid went out, emails, things went to them. Some you see a few quotes there. There was a lot of non-responses, and then there was those as we continue to reach out, they just said, we decline, we're just not going to bid it. So, Mr. Chairman, that is the bid. This did go through, the route this went through is purchasing, insurance committee, back to purchasing, and now to this committee on the property and casualty insurance.
Okay, you've heard those numbers. A couple of us that are on purchasing have seen these. Are there any questions for the director about these rates, or do I hear a recommendation?
Mr. Chairman, so this has basically gone up $1 million?
It's what?
It's basically, premiums have basically gone up $1 million, or am I misreading this? In other words, the expiring is 4.167, and
Yes.
So it's gone up $1 million. The annual premium's gone up $1 million. Yes. Okay. Okay, and it's attributable to the additional buildings.
So the breakdown.
I'm trying
Yeah.
to get my head around, that's 25% in 1 year.
Yes, so going back to the first page,
Okay.
you have your building and contents, and that's the biggest part of your increase. When you look at the building and contents, you have the expiring rate, and then you have the new rate of .132. If you look at the building increase, the values and the contents increase. That contributes, keep in mind, like last night, if you don't raise the value of those buildings each year, then if you have a tornado hit, then when you get ready to build it back, you won't be anywhere close to what you've got it figured. So also in that amount that you have is an inflation factor. And you know what inflation was for the last year or so. So built into that cost, you have a rate increase and you have an inflation factor that causes that premium, that increase. And that's, when you look at it from 2.392 to 3.167, that's the largest part of it. The additional buildings and then the inflation too.
Seems a lot, 25% for what we've added in inflation. I'm just a bit surprised.
We had the same discussion in purchasing, exact same, and kind of looked into this, and basically the rate increases that we're seeing are pretty well across the board for other entities too. So this is not, us being gouged. Possibly some of the reasons we're not getting as many bids is they knew that they could not compete with the bids we were getting. I can't say that, that's exactly what it was, but that's my opinion.
And we looked at changing the deductible, I presume, or whatever that is, and things along those lines as well, picking up some self-insurance for part of it, or some kind of additional, you have your basic insurance and then you can have layer insurance on top of it. I mean, I'm looking for some assurance that and I'm getting a nod or two there, but I'm trying to get a sense for we've looked into adjusting some of those things and looked into some of the kind of overlaid insurance, or whatever you want to, about limits above the basic policy. Excess. That's exactly the word I was looking for. Sorry. That some excess type policy as well as some self-insurance on some of this. I'm just looking for a little bit, because that's a big premium number. That's almost 2/3 of a penny, I guess, based on last year's numbers. That's a lot.
I'd like to recognize Mayor Carr. I think he may have something that can help us with this.
Commissioner Irvin, that's an excellent question. That's a question we talked about, not as much as we should have, but one that will continue in purchasing. And Ed, I want you to chime in here. Rutherford County's size creates some concern because of our insurance needs. And Ed, I want you to chime in here, please. Our size is actually not a benefit, because we're so large. Some insurance carriers don't want to bid because of our size and the exposure a claim would have to their business model. You'd mentioned that in purchasing with the limited number of bids that we had, because we put this out in a number, and Ed, please correct me if I'm mistaken. No, I'm serious, please. But my understanding was some of your comments and Galler's comments, some carriers refused to bid because of the size of the county. Is that accurate? And so that's a factor we're having to work with. And so when we found that out, we obviously, and it's interesting you bring this up, Commissioner Irvin, because Ed and Michael and I had a conversation about this very topic earlier today, and said, how can that being the case, then how can we reposition ourselves? And the conversation came up about self-insuring and those kind of things. So we understand the issue, Ed, if you would comment, please.
Yes, so in our RFP, we also, instead of just a $500,000 SR, we gave the option of $1 million, and no one would even take a look at it. All of them, well, the bid came back at $500,000. Michael also reached out to the Tennessee Risk Pool. They weren't interested in I won't say giving a quote, but you get so close, then you have that disruption of changing everything over. So, but I gave Michael all the same numbers, and he reached out to the Tennessee Risk Pool. The other thing you have to consider, and I'll talk about the property first, is that when you talk about Rutherford County, you're talking about rates, and you might be able to go to another county that's more sparse. But I'll give you an example. One thing that's been discussed with the underwriters is take Blackman, for example. In the Blackman area, you got Blackman Elementary School, Blackman Middle School, Blackman High School, EMS, Sort Building, and one stop. So again, if something came through there, you're getting close to your $250 million limit or more. And so it doesn't mean that a tornado would come through and destroy all of those buildings, but you have a chance, like up here at the square, you have a chance of getting multiple buildings and have to where when you look at the premium as opposed to the risk that is there and the value of the buildings, it gets pretty tough. You got to have some pretty deep pockets to be able to take that risk to afford the loss if you have one. And again, I go back to another one of the things in the discussion was, and last night was one of those, is that the weather, not only for Rutherford County, but all of this area, you're seeing greater damages and higher costs. So that's what also adds to the increase in the property rate, is just the change in weather. We didn't see this much serious storms like we have now. So that's another one of the reasons, as far as rating, they're looking at this area as far as total losses. And to be quite honest with you, on property, we've had very good luck. We've had, I think the sheriff's office had a fire with some dryers and some washing machines, and we had the ag center. And then other than that, we've had very few, claims that would reach over, 50,000. So, but we're in that storm with, this area as a whole.
So it's fair to say that we have looked at reinsurance or insurance, self-insurance. We have looked some and will continue to look at self-insurance with excess policy limits, that we could somehow blend that with what we have now, because this strikes me as high. I'm sure everyone's done the best they can. I'm just trying to wrap my head around a 25% increase for property that, we have to insure. I get that on some level, either ourselves or through someone else, through some excess policy, usually. But that's a pretty steep increase. And I wanted, the other piece is just kind of I think someone's already addressed this, Ed or the mayor, was this is comparable to what other folks are seeing. Is that a fair statement?
Yes, let me add two things. So I looked at, Ed is correct, so I reached out to the Tennessee Risk Management Trust, which would take us away from being self-insured. It would be us fully insured. I checked that price as well. We do not have to bid if we go with them, so there's no harm in checking that. So we checked that. That was not advantageous to this. And then I also reached out to a couple other counties who were similar in our size, whether that be Wilson, Hamilton, Williamson, and some other Middle Tennessee areas. And their rate increases were some were a little more and some were a tad less. We were kind of we were on the low end of the rate increases. One of the issues has been, just like if you've heard in like Florida or California where some of the insurances are pulling out, there's really only 2 people in this area that are large enough to insure us. And even the state or Tennessee Risk Management Trust, they're reinsured by Travelers. And so Travelers is one. Liberty Mutual used to be one, but they declined to bid. And so we also then looked at how high can we raise our, I call it a deductible, but I guess SIR whatever the technical term is you want to use. We looked at that, seeing how high we could raise that to get that break-even point, because there's always a break-even point, I think, is kind of what you're referring to. And so this was kind of the sweet spot for us to be able to still balance the budget while also not taking on some unnecessary risk, while also battling, we have full replacement cost coverage, which is expensive, but at the same time, if it hits, I was in a situation in Wilson where it hit an elementary and middle school right across the two, and it's a really good thing we had the full replacement cost, and I think that's the biggest chunk of the rate increase here, and Ed can correct me if I'm wrong, is when we asked for that and our values, the inflation to replace that school, it didn't cost us $150 million to build Oakland, but it would sure cost us $150 million to build it back, and I think that's what you're seeing. But Ed, correct me if I'm misspoken there.
Yes, RAI comes out and they'll reappraise our buildings, especially anything that comes out new. They've been out to the public health buildings, just again to make sure that you're not, what you're insuring, you can build it back for that. So, and that goes back into that inflation factor.
Okay, we
Thank
pretty
you.
well beat this around, and I would like to move on if that's all right. We've had pretty good discussion on it. Anything else? Not. Mark, call roll on this, please.
I don't have a motion.
I thought we had a motion and a second on this. I'm mistaken. I will need a motion and a second to accept these bids.
Motion to accept the bids, Mr.
I have a motion and a second. Mr. Pearson. Call roll, Mark.
Commissioner Gooch?
Yes.
Commissioner Harris? Yes. Commissioner Irvin? Yes. Commissioner Johnson?
Yes.
Commissioner Piercy?
Yes.
Commissioner Shrino? Commissioner P?
Yes. Motion carries. Okay.
Okay, the next item you have is the medical, dental, and vision plan renewal. And I did give you some bullet points on it also. On the first page, you see where the 2025 active and pre-Medicare medical rates reflect a zero increase over 2024, and the 2025 deductible and out-of-pocket also remains the same as 2024, unless something is mandated by the IRS. And every now and then something will come out and say, like on the high deductible plan, you can only have a minimum out-of-pocket or something at a certain amount, and we have to adapt it to the IRS regulations. So 2025, you have dental vision rates reflect a zero increase. You have a Cigna Vision carrier will transition from VSP to IMED in 2025 as of January 1st. 2025, you have Cigna Medicare Advantage True Choice rates reflect a 27.5% increase over 2024. I will mention to you, these are the recommendations from the Insurance Committee with that exception, because that rate was not, we did not have that rate on the time that the Insurance Committee was held. So that did not go before the Insurance Committee. And then the next one is you have a 2025 stop-loss renewal with a list base rate increase of 19.25 to remain at 400,000 pooling point, or premiums can go at, or you can select a 500,000 pooling point, which would reduce it by $245,423. And that was the recommendation of the Insurance Committee. And then you also, going back to options, Commissioner, we also asked for a pooling point of $750,000 and for your stop loss, and that would be a reduction of $541,440.78. You'll see the rates, which again goes back to they're the same as what they were for 2024, with the exception of the Medicare rates. And just to give you a little bit of an update, I know the 27.5%, when you look at it, you're like, okay, that's a large number, and to me, I agree, it is. But if you look at, just to give you a little history, if you had and this is on the Medicare Advantage rates that you see, the grandfathered, you'll see for a single person, $261 is what the rate is. if I take you back to 2022, where we were self-insured, and we left and went to Cigna Medicare Advantage, it dropped from 605 to 261 now. The employee in 2022, their portion, the retiree, was $151.50. In 2023 and 24, because there was not a rate increase in 2024 for Medicare. So it dropped to 51, the retirees portion dropped to $51.19 from 151. In 2025, with that increase of 27.5 cents, it's an increase of $14.06. That's the cheapest plan. So if you go to one of the most expensive ones where it's employee, where it's a retiree family. Now keep in mind, the retiree families, there's not very many people post 65 with dependents. There are some, but there's just not very many. If you looked at the most, one of the most expensive ones, in 2022, you had $1,545 was the rate that was assigned to that tier. On the non-grandfather plan, you had the retiree paying $772 a month. When we went to Medicare Advantage plan, it dropped to $261.06 a month. And now we're raising it $61.72 to $322. So at 2022 rates, you had it at $772.64. With the increase, you're now at $322.78. You're still nowhere close to what it was, the reduction in 2022. And I will mention also that Cigna has come to the insurance committee and has told that they are divesting their part of the Medicare Advantage. And we're going to bid this out for 2026. It'll be bid out because since we're not under the Cigna umbrella and they're out on their own, we'll need to bid it out. And I've discussed that with Michael, and I mean, he's agrees that that's what we need to do.
One thing I want to point out, since you are talking about the retirees' benefits under the Cigna Medicare Advantage, then I'm going to state that I will be voting under Rule 10 because I am under that Medicare Advantage plan. So I want to say that up front. Having looked at these, most of these rate increases are zero. I mean, get down to the last one, and then, of course, I don't know what's going to happen with the VSP, but that's usually pretty insignificant compared to the rest of it.
Mr. Chairman,
As Commissioner, go ahead, Commissioner.
I follow Rule 10 too.
Rule 10, okay.
Rule 10.
Commissioner Johnson, okay. We've heard the presentation. Do I hear a further discussion or a motion?
So moved. Second.
I have a motion and a second.
Is this, Mr. Chairman, is this approving the recommendations of the insurance committee? Is that what we're doing? I just want to make sure what we're doing, sorry.
You're approving the recommendations and the actual rates within those, which would be the 0% increase for medical, dental, and vision, and including the 27.5% increase for Medicare Advantage, and then the stop loss rate, I believe, is also in this as well.
Yeah, the stop loss is next.
I mean, when you mention it in here, I don't know if you want to take it at the same time. You can.
Okay, I can take it to...
Do I hear anybody that wants to separate those? If not, I want him to go ahead and continue, and we'll look at them all together.
That's fine. I was just want to clarify if it's in or out.
Yeah, let's go ahead and put it in unless I hear someone say not. Go ahead, Ed.
Okay, so on the stop loss, you will see, and that's under 6C, the individual stop loss, your pooling point. Now, you're self-insured up to the $400,000, and then any claim after that, there's a reinsurance that kicks in. So, a couple things, and I want to be very careful that I don't break any HIPAA laws here, but I'm one of those that, you can self-insure up to a point, and then you need to have something to kind of catch you in case something happens. This year, we had a catch, and that was we had a claim that went to $2.4 million, but our stop loss was at $400,000. So part of what you look here is your high-dollar claims, and you look at also how many of those claims that you have now in the last 12 months are reoccurring. Like, was that they had a hospital stay and it was a one-time thing and they're better and they went home? Or is it something that you look at that for the next 12 months you're still going to have reoccurring medical expenses? So with Gallagher, we sat down, we did all types of analysis, and I'll just be honest with you, whether it's 400, 500, or 750, you're trying to predict a large claim that somebody's going to spend it's going to cost you over $400,000, $500,000, or $750. And in some of these, the claim hasn't even occurred yet. They haven't even been diagnosed, because this will be effective as of 1/1 of 2025. So you try to look at your history, and you try to look at the claims that you have now in that. So I'll give you just a little bit of a breakdown on the claims we have now. We have rolling 12. We have one at $429,000, one at $319,000, one the $2.4 million that I mentioned to you, one at $203,000, one at $289,000, one at $186,000, and one at $440,000. So you have one between $150,000 and $200,000. You have two between $200,000 and $300,000. You have one between $300,000 and $400,000, and you have two between $400,000 and $500,000. So if you look at the savings that you're talking about here, and if the trend remains the same, and again, you don't know. The recommendation from the insurance committee was to go to the $500,000, and at the $500,000, if you had two claims, and if you look at the size, if you look at the claim at, if you had two claims, that would be $100,000. That went over 500. That'd be $100,000 each. You would still save $45,000. And so based on the large claims, based on what Gallagher, our broker, brought to us, it was the recommendation of the insurance committee to go to the $500,000 individual pooling point.
Okay, I made a mistake, and I want to clarify what I did here. I asked him to continue, and we already had a motion on the floor to cover everything up to the stop loss. So what I'm going to do, we can have discussion, but I'll ask, I think Commissioner Serino, you made the motion, and then you
Mr.
seconded
Johnson
it.
made the motion.
Would it be okay for y'all to add this stop loss to your motion? Is that okay? And okay with your second? Okay, so I wanted to clarify that before we went any further. Sorry about it, guys. Any discussion on this?
Mr. So the premium, basically, if you go to 500, it goes down a bit, goes down a little bit? Is that what we're saying versus last year?
Yes.
Okay, okay, I just want to clarify.
Okay, any other discussion? Call roll, Mark.
Well, I don't know what the motion is on the stop loss, because
Motion is the same as the initial motion. We're just adding the stop loss to it, to the.
No, I mean the level of stop loss. Is it 400,
The insurance
500,
committee's
750?
recommendation of $500,000. Is that,
500,000, okay.
is that what we're adding to it? Okay.
Okay. Commissioner Gooch?
Yes.
Commissioner Harris? Yes. Commissioner Irvin?
Yes.
Commissioner Johnson?
Yes.
Commissioner Piercy?
Yes.
Commissioner Serino? Yes. Commissioner P?
Yes, motion carries. Thank you.
Okay, so the last thing that I have is the healthcare flexible spending account. And as you're aware, we'll be bidding these out. So we're trying to go through all the plan documents, see if there's some things in there that we want to clean up in that. In this health spending account, there's two things. It was taken all as one recommendation, but I don't want to muddy the waters here. But one of the things that we're asking is the IRS regulates how much carryover you can have from year to year. And so a lot of times when we get to carryover, it will be, for instance, in this one, you have $640,000 for 2025. What we're asking, and this flexible spending account is not anything that the federal government, that that Rutherford County contributes. This is all an employee-contributed fund. So, but the county pays a fee to maintain this fund of $3.10 per month. So in this process, what we're asking is that when the IRS makes a change and that employee can have a larger carryover, we're asking that it automatically mirror what the IRS regulation is that allows us to have that maximum carryover. It's the employee's money, and so if they didn't spend it all that year, then be able to carry over that amount. Right now, it's for 2025 is $640,000.
640.
I'm sorry. Thank you. $640. That was one recommendation. And then the second recommendation is if someone has a flexible spending account and they decide they don't want to do it anymore, they want to do something else with their money, they can have a balance in there. And in that balance, it can range anywhere from what the maximum carryover is to 1 cent. So in that 1 cent, we're paying that $310 per month until they spend out that account. Because if you're an active employee and you haven't left the county, then your account can stay active till you leave or until you get back in and start using the flex spending account again. So, and some people get out and then they may only have a few cents that they didn't spend, and yet we're still paying month after month $3.10. So the recommendation is to, beginning January 1, that we move for the carryover with no limit to a carryover time limit of a plan year of 1 year. So if you got out of the flexible spending account, then you have 1 year to spend. Again, if you carry over $640, then you have 1 year to spend that carryover amount until it expires, or we can, they forfeit it, instead of it just sitting there and us paying over and over and over again a monthly fee and it being stagnant. So that was also the recommendation of the insurance committee.
Any questions for the director?
Quick question. So there's no additional cost to the county under year over year?
Well, that's what we're trying to do, is save a cost,
Right.
because those
There would
people
be a
have
little
gotten out of the
decrease.
account. We're still paying monthly
Right.
until they get a zero balance.
There'd be a little bit of a decrease.
Yes.
Perfect. Understand. Thank you.
Any further questions? If not, I'll entertain a motion. Motion to approve the recommendation from the insurance committee. Do I hear a second? And a second. Further discussion. Call roll, Mark.
Commissioner Gooch?
Yes.
Commissioner Harris? Yes. Commissioner Irvin?
Yes.
Commissioner Johnson?
Yes.
Commissioner Piercy?
Yes.
Commissioner Sereno?
Yes.
Commissioner P?
Yes. Motion carries. Thank you, Ed.
Thank you.
Okay. Next up is the general fund budget amendment for the sheriff's office. Welcome, Chief.
Good evening. I'm Steve Spence. I'm a deputy chief with the sheriff's office. This amendment is to recognize additional unbudgeted revenue and appropriate money for new laptops with updated Windows software, computer monitors, updated cameras, additional weapons and vests for the sheriff's office, asking to place $686,000 into our data processing equipment and $100,000 into our law enforcement equipment.
Okay, you've heard his request. Any questions?
He has another amendment. You want to take it also? Another?
Yes, let's continue unless I hear someone say otherwise.
Yes, sir. This amendment is to recognize the revenue from other charges for services we received on vehicle fees and to recognize revenue from insurance recovery on 3 total vehicles, requesting to put $150,464 into our motor vehicle line item.
Steve, has that got them all?
Yes, sir.
Yes, sir.
All right. I have a motion to approve. Second. And a second. Any discussion?
Is this increases for SROs, or is this taking it out of an SRO grant and putting it
It's
into,
taken from the SRO grant and placed it into these line items.
and putting it in other, okay.
We had some unbudgeted grant money, and this is utilizing that money for some other one-time costs, so that way we're not spending a reoccurring revenue. We got that next year for SROs. So it's some leftover money we haven't budgeted.
And if you don't spend it, then you're going to return it. It's the
No,
way-
we've spent
but we've
this,
got
if
this.
you remember last year, we budgeted, we added some SROs, but the governor's appropriation added $75,000 per SRO. But that was after that was part of that special legislative session, and so we weren't for sure if it was going to be in the governor's budget at the time. So as a conservative way, we just didn't budget that revenue. And so after the fiscal year started, that revenue did come up front, given to us to reimburse us $75,000 per SRO. We did check with the state, and they did allow us to supplement and supplant with this grant because we've already had our SROs budgeted. They did approve that, and so now we're using that unbudgeted revenue. Now, next year, it's budgeted in the book in front of you, but at the time, we'd already had all the SROs budgeted, and so we're using this on some one-time costs so that we apply this to the SROs next fiscal year.
Great, thank you.
Thank you, Michael.
Any further questions? If not, I'll entertain a motion on this.
We got a motion.
Got it?
Got a
All right.
motion.
Any further discussion? Call roll.
Mr. Gooch?
Yes.
Mr. Harris? Yes. Mr. Irvin?
Yes,
Mr. Johnson?
Yes.
Mr. Piercy?
Yes.
Mr. Shrino? Mr. P?
Motion carries.
We are requesting to apply for a State of Tennessee Mental Health Patient Transport Grant. The grant is a no-matching grant. The amount is based on the number of transports during last year, during their formula. This is the third time we've applied for this funding.
motion to approve.
I have and a second. Any further discussion? Call roll, Mark.
Commissioner Gooch?
Yes.
Mr. Harris? Yes. Mr. Irvin?
Yes,
Mr. Johnson?
Yes.
Mr. Piercy?
Yes.
Mr. Shrino?
Yes.
Mr. P?
Yes, motion carries. Please continue.
Yes, sir. This amendment is to request funds from special purpose DEA restricted for public safety into our confidential line item, requesting to put $30,000 in the confidential line item.
motion to approve.
Second.
I have a motion and a second. Any discussion? Call roll, Mark.
Commissioner Gooch?
Yes.
Mr. Harris? Yes. Mr. Irvin?
Yes,
Mr. Johnson?
Yes.
Commissioner Piercy? Yes. Mr. Shrino?
Yes.
Mr. P?
Yes, motion carries.
Thank you.
Next up is a general fund budget transfer for OIT. Hadn't seen you in a while, Cody, so that's usually a good thing.
That's usually a good thing. I try, no offense, but I try not to come as often as, or as little as I can, so. This is, OIT is requesting that transfer from one line item to other, no new money. And this is to address a situation that was created by our, we changed email archive vendors, and there were some unanticipated costs associated with the archival process. So this is just moving money that was created by some efficiencies in our 709 line to the 317 line.
Okay, you've heard the request. Any questions?
second.
Motion and a second. Further discussion? Call roll, Mark.
Mr. Gooch?
Yes.
Mr. Harris? Mr. Irvin?
Yes,
Mr. Johnson?
Yes.
Mr. Piercy? Mr. Shrino?
Yes.
Mr. P?
Yes, motion carries.
Thank you, Chairman and Committee.
Item 11, general fund budget transfer for drug court. Good evening.
Good evening, Lachelle Ricks, Director of the Recovery Courts. We are requesting to move funds from our office supply line to our travel line, just to cover the cost of some of our conference and a training that was recently added.
Second.
I have a motion and a second. Any discussion? Hearing none, call roll, Mark.
Mr. Gooch?
Yes.
Mr. Harris? Yes. Mr. Irvin?
Yes.
Commissioner Johnson?
Yes.
Commissioner Pierce?
Yes.
Commissioner Shrino?
Yes.
Commissioner P?
Yes. Motion carries.
Thank you.
Thank you. Okay, item 12, Ambulance Service Fund Budget Amendment. Welcome.
Good evening. Brian Gaither, EMS Director. We have a budget amendment. We're requesting to move $1,900 from our donation line into our supply line for EMS week supplies.
You've heard the request. Any questions?
Motion to approve.
Motion,
Second.
Commissioner Johnson, second, Commissioner Irving. Any further discussion? Call roll, Mark.
Commissioner Gooch?
Yes.
Commissioner Harris? Commissioner Irvin?
Yes.
Commissioner Johnson?
Yes.
Commissioner Piercy?
Yes.
Commissioner Shrino? Commissioner P?
Yes. Motion carries.
The second thing is asking for permission to apply for a state grant. It came out of the governor's budget. There's a total of $2 million available for ambulance services across the state of Tennessee. It's a no-match grant. They are going to award between $5,000 and $150,000. It's kind of a weird setup. We just had a meeting about it yesterday, but you have to have the item by June 30th, but you can go back, and if it's been purchased from July 1, 2023 till now. So we're gonna apply for a reimbursement for some equipment that we've already purchased.
Michael, go ahead and
I
explain.
need to make a comment on this. This grant application is due May 15th. I believe the county commission meeting is the 16th. However, if this committee does approve this, we will go ahead and apply, and if something happens, it gets denied the next day at commission, we will then pull our application, but we hated to miss out on the no-match funding for reimbursement for some things we've already purchased.
Motion to approve.
Have a motion
So moved.
and a second. Any further discussion? Call roll, Mark.
Commissioner Gooch?
Yes.
Commissioner Harris? Commissioner Irvin?
Yes.
Commissioner Johnson?
Yes.
Commissioner Piercy?
Yes.
Commissioner Shrino?
Yes.
Commissioner P?
Yes, motion carries.
And the last thing is we're wanting to change some of our patient charges rates. We haven't had an increase since 2019. We have 6 different levels of calls. They all kind of vary. We had our billing company do a study across in our area, and we settled on a percentage of the Medicare allowable, and some of the rates went up and some of the rates stayed the same. But we do think that it will be an increase in revenue.
Any questions for Brian on this increase? And you said it was 2019 was the last time you
Yes, sir.
saw an increase?
Yes, sir.
Can you just give us kind of a thumbnail on the ones that went up?
Yeah, so we were behind on the BLS emergency rate, and in each one of these calls, they depends on what we did of which classification that they fit into. So we were a little behind on the ALS emergency rate and the BLS emergency rate, and then the ALS2 and specialty care, which those, especially the specialty care, it's less than 1% of our total calls. That's the one that had the biggest increase, but we probably make 5 or less of those a year. And this will really only impact the commercial carriers because Medicare pays what Medicare pays. It doesn't matter what we charge, but everything revolves around Medicare rates, so we base this on about 175% of Medicare allowable, and that's kind of what our area does, is that percentage. Wilson County does 165% of the Medicare allowable. But with Medicare, you could charge $10,000 a call. They're paying their rate, period. But the commercial carriers do pay more.
This is going to make a difference in his budget. You know, I think we've got this cooked in already. If we turn this down, then we'll see this when we look at his budget later on, just to kind of give you a heads up on that. But go ahead.
Right, I was just curious if okay, Medicare picks up some, does regular insurance pick up some, or the difference if you're not on the Medicare? How does that work?
The increases in revenue will come from the private carriers, commercial carriers. The Medicare numbers that we receive, they pay what they pay. They have a rate, and that's what they pay. Same with TennCare, which is 67.5% lower than the Medicare rate.
Do we accept the Medicare rate, or do we then bill for the difference?
So it depends on which Medicare program they're in, and if they got a deductible, that could alter what they pay. It just depends on if it hits their deductible or if they have a copay. It kind of just depends on the plan. But if we would have had these rates in 2023, we would have had roughly about a $500,000 increase in revenue.
I'm just trying to understand how it works. That's what I'm trying to understand.
Yeah, trying to explain the charges and the payments with ambulance service billing will take a long time. And if you wanted to come by one day, I'd be happy to sit down with you for a couple of hours to kind of break that down for you.
Yeah, that'd be great. We'll set that up. Thank you.
Okay, you've heard the request for this rate increase. Any further discussion, Commissioner Johnson?
Be extremely hard to put a monetary value on your life. Motion to approve on this.
I have a motion to approve and a second. Commissioner Piercy, further discussion.
I was going to ask, Commissioner Johnson, would you pay the Medicare rate or the regular rate?
He said Medicare rate.
He said Medicare rate,
Yes, sir.
okay.
Brian? Brian?
There you go.
Brian, is there an effective date on this? Or is this upon passage?
July 1.
Is it a July 1? Okay.
Okay, you've heard the discussion. Any further questions? We do have a motion. Call roll, Mark.
Commissioner Gooch? Commissioner Harris? Yes. Commissioner Irvin?
Yes.
Commissioner Johnson?
Yes.
Commissioner Piercy?
Yes.
Commissioner Srinion?
Yes.
Commissioner P?
Yes.
Thank
And
you.
I'll concur with Brian. I've had a discussion with my insurance carrier, and they really have some interesting ideas on ambulance payment. Like I said, I would advise you to call your carrier and ask them. So, next up is our state litter grant for 2024-25. Bill? Hadn't seen you in a while.
That's been less than 24 hours, I believe.
Yeah.
Bill Cope, Superintendent, Correctional Work Center. I'm requesting to apply for our yearly state litter grant. This will be the 2024-2025. The only difference between this year and last year is $100 less. But we've been awarded this grant for several years, and then before us, Solid Waste got the same grant. So there's not a whole lot of difference. The only difference this year and last year will be some of the education piece, which our PIO takes care of. But from our end, there'll be no difference in it.
Is there any match to this, Bill?
No.
Just wanted to clarify that.
No, and it's a reimbursement grant, so it just reimburses our staff for what they do.
Second.
I guess Serena on this one. Any further discussion? Call roll, please.
Commissioner Gooch?
Yes.
Commissioner Harris? Yes. Commissioner Irvin?
Yes.
Commissioner Johnson?
Yes.
Commissioner Piercy?
Yes.
Commissioner Srinion?
Yes.
Commissioner P?
Yes, motion carries.
Thank you all.
Thank you. Okay, item 16, general fund budget amendment for the county mayor.
So 2 meetings ago, for the purchasing committee, the purchasing committee accepted 4 RFPs for the construction manager at risk for the forensic design and engineering of the proposed forensic center. And we had 4 bidders. All 4 bidders were competitive. I believe it was R.C. Matthews, Bell Construction, American Construction, and Reeves. The purchasing committee unanimously awarded the prospective contract to R.C. Matthews, subject to negotiation. R.C. Matthews came in at $50,000 and 4% of the construction cost, which was a little higher than the other bidders, but their experience specifically in forensics facilities was a significant and determining factor of that, and they had a rather large local presence here in Middle Tennessee. I'm pleased to announce that after negotiating with R.C. Matthews, they have agreed to reduce their percentage from 4% to 3%, saving the county $150,000, subject to this committee and the full commission's approval. So this was for design and engineering services for the proposed but not yet funded forensic center.
Okay, you've heard the request for a project manager.
No, sir. This is for the CM at risk. It's like a project manager, but I want to make sure we get the vernacular right. This is for CMA at risk to help in the actual design and engineering with Klein and Associates.
So, are there any questions or discussion, Commissioner?
So right now we're at 900,000, and this would be in addition to the 900.
That would be correct.
So we'd be looking at $950,000.
Keep in mind what you're looking at on the budget amendment. The $900,000 is a budget to transfers out in the general fund. So this project is held in Fund 171. So this money would be going out to the Capital Projects Fund as part of the other design funding that's been appropriated.
Is this necessary to complete the design work, or is it something that, because here's my concern, we've approved the initial design work for the, potential forensic center and the EMS components as well, as I understand it. If it's approved, okay, then everything chugs along. If it's not approved, then we're out 900 plus 50.
Only if the county determines that we never determine that we need a forensic center. Because what we're doing is follow me here, what Klein and potentially R.C. Matthews is doing is collaborating on building or designing and engineering a forensic center. So whether this body and the full commission approves it in the fall, and that's our anticipation, is to come back to you in the fall for a recommendation for funding for the forensic center. That's a separate matter. But whether this body approves it or not, we have a designed facility that at some future date, this body can then appropriate the funding for construction. And because of the uniqueness of a forensic center, it's a genuinely unique engineered building, I wanted to mitigate the risk associated with the designing and architectural such that this building will have a not-to-exceed amount of $15 million. That's why I went with a CMA at risk, because they guarantee a not-to-exceed amount, as opposed to going to a hard bid. You don't know where the hard bids are come from. The hard bids, based on engineering, could come anywhere, and you don't know. But I wanted to mitigate that risk, Commissioner.
So this $50,000 person is mitigating the financial risk,
yes,
as opposed to mitigating any kind of physical risk or anything along those lines.
I don't know what you mean by physical risk.
In other words, he's not looking at the plans and saying, no, you can't have a hallway of this amount, you have to have...
No, yes to both questions.
Okay.
Absolutely.
Okay.
That's the point.
Okay, I want to understand then. So we're talking about the financial side as well as the health risk management component.
Correct.
For $50,000.
So example, Bart Klein is excellent at, as you know, because they've been servicing this county for years. Klein & Associates has. They're really good at architectural design. What architects aren't particularly adept at is holding costs down when it comes to FF&E, materials, the materials that go in that, the type of structure. That is more of construction management, and we needed that construction management piece, hence the word or the term construction manager at risk. We needed somebody who's well-versed in managing the finances of the cost associated with the actual construction of the facility. Whether it's constructed or not, we still need that component if we're interested in mitigating the risk, which I didn't want this to exceed $15 million.
So if we expend $50,000, we're assuring ourselves, guaranteeing, maybe not, that it will not exceed $15 million.
We are assuring ourselves that it's not going to exceed $15 million. That's exactly right.
Whenever it's built?
No, sir. No, well, because if it goes out 5 years, there is a time limit. There's a window there, obviously, because we can't calculate for inflation or cost of goods or materials or that kind of thing. So absolutely, there is a time limit there, absolutely. That's correct.
That's what I'm asking. Now, is that for a year, 2 years, 3 years? What's the 50,000 by us in terms of an assurance of not exceeding $15 million?
I don't have an answer for you on that, Commissioner. I know that typically when this project, the design portion of this project is going to be complete, 100% complete on around October, we will have that number at that time. So, but that won't be, you will have that time frame in advance of being able to consider a vote as to whether or not to appropriate the money for funding. I won't have that number until they get substantially complete with the design phase, if that makes any sense. We need to get a little further along in the design phase before I know what that time frame is.
Chairman Harris, you're recognized.
Mayor, why are you not using the PBA? I mean, is that not what we created them for, is this job right here?
Well, I didn't create the PBA, so I can't answer for why it was created. In my mind, the PBA is an excellent tool for facilities and buildings that are rather alike, but when it comes to something unique, we discovered, especially with, quite honestly, Commissioner, with the one-stop building, that they had difficulties making a quorum, and a decision couldn't be made. And the timeliness of this particular type of facility, time is money, and I just didn't feel like a facility like this or like the transfer station were best suited to running through the PBA. Obviously, an EMS station, a public safety building, something that we've got, the PBA's got experience in doing, or this body's got experience, I'm fine with that. But because of the uniqueness of this kind of facility and the concern about drawing a quorum, I didn't feel like the delay was worth the expense.
So I haven't seen your budget, so obviously, what unfulfilled position did you have that you can fund this?
I'm sorry, I didn't hear you.
It says on my thing here, you got money left over in your budget to fund this.
Yes.
And it's based on an unfilled position.
That's correct.
Which position is that?
So at last budget year, you'll recall that we put in a project engineer specifically as a seed money for this particular facility, but to move forward. We never filled that project engineering position. And so in lieu of that, we have used a portion of that money out of that particular position that we never filled.
Okay. Now, That's a good point. That position is supposed to oversee all the county, so.
That's correct.
Now you're creating two positions?
No,
what
sir,
we
we're
gave
not.
you?
No, sir, we're not. The purpose of that particular position, and quite honestly, this is really an excellent question, because it was determined that the uniqueness of the transfer station, the uniqueness of the forensic center necessitated a project manager. Because we secured the services of SEC Engineering to oversee the transfer station, and because of the necessity for a CM at risk manager for the forensic center, we didn't need those duplicated services with a project manager or an owner's rep. And so it was unnecessary, and I didn't see it necessary to have a duplicate services for something we didn't need. So based on Michael's recommendation, we're pulling $50,000 out of, I'm not sure, was it 110 or 120, something like that? We pulled 50 out of that position and moved it for this CMA at risk, which is ostensibly working as the same thing as a project manager. It's just, they're just not an employee.
So if you hire this person at this amount and you don't get your forensic center voted in, so is that guy just fired automatically?
Well, this isn't a person. This is R.C. Matthews.
Consultation? Is that what this
Well,
is?
they're more than a consultant. They're hands-on engineering construction managers. So if the point being is the $50,000 is to assist Klein and Associates with the architectural and engineering services necessary to design the building. The 3% kicks in on if this body appropriates the money for the forensic center, but only if this body appropriates that money, that $15 million. So theoretically, we could be out $50,000 if we never voted on a forensic center, but we will always have, the plans, architectural engineering plans for the forensic center, regardless of when this body decides to approve a forensic center. And those construction management services are imperative with this particular facility, in my mind.
So this expert actually would be working for Klein?
No, sir. They will be working for the county.
Okay, so there'll be benefits and all that?
I'm sorry, no, sir. They're not an employee. They're a contractor.
Okay.
But they are a contractor to the employee. So we will bring a contract to the county commission for approval, $50,000 for engineering services, and then if the contract is approved for construction of the forensic center, then they will get a 3% fee for their construction management services for that forensic center. So there's two parts to this. There's the $50,000, which is design and engineering, and then once the commission approves, when they approve, then they will receive 3% for construction management, which is important because they will be managing the construction for the design for which they participated in.
The only thing I want to clarify on there, the money that was set aside by the commission, which is in the funds that are available for a project manager, what he's requesting is to take $50,000 to pay this individual out of that, which this committee would have to vote to do. You know, that money is not automatically laying there, the $50,000 for them to pick up for this. This is something he's basically requesting that.
Tonight, you're voting on a budget amendment. The contract went through purchasing, but that was an unfunded contract. So then tonight, you're voting on a budget transfer in the mayor's budget to transfer that money to the Fund 171 General Capital Projects Fund. And this $50,000 is just for the design phase of the project. So I just want to be clear that if nothing else gets funded, this is just for the design phase. And then still on the consent agenda at commission next week will come the minutes from purchasing where they approved or awarded the RFP or Q? RFP. I'd like to add one thing. I think I want to clarify. We're not hiring two people, getting a little ahead, but you haven't, and when we talk about the budget, the mayor is proposing to eliminate the unfilled project manager position. He's proposing to eliminate that in his next year budget.
Okay, you've heard the discussion. Mayor, is there anything else you want to add or any questions from the committee? If not, I'm going to entertain a motion.
Move to approve, Mr. Chair.
Second.
I have a motion and a second for approval. Any further discussion? Call roll.
Commissioner Gooch?
Yes.
Commissioner Harris?
No.
Commissioner Urban?
No.
Commissioner Johnson?
No.
Commissioner Piercy?
Yes.
Commissioner Shrino?
Yes.
Commissioner P?
Oh.
Motion fails.
Okay. Next item is item 17, report on debt obligation for 2024 GO refunding and school bond issue. Michael?
So this report is a report that's required to be presented to this body and to the commission. It is the exact same numbers that we talked about at last month's meeting and last month's commission meeting, but this is the actual report submitted to the comptroller and is required to be presented to y'all. I don't believe there's a required vote. I believe it's for information only. So I'd be happy to answer any questions. Everything is the same of what we went over last month. The very first page does show our true interest cost at 2.818. Does show the premium amount that we talked about, and then the refunding part. But I'll be glad to take any questions if there is any.
Again, he presented this at the full commission last month, and we just didn't have all the final numbers. You got the numbers now. Any questions? If not, we don't have to take action here, do we? Hearing nothing, we're going to go ahead to the next item, which is the 2024-25 Smyrna Rutherford County Airport Authority budget.
So this is required for us to take a vote on to approve. We've looked at it. We haven't seen any issue with it. It does include their debt payments to the county, as you'll see when we get to our Fund 119. But it is required for us to approve it. But the finance office hasn't seen any issue with it.
Any questions or discussion? As he said, they have built in what they're repaying us on the money that we put out. So,
Are there significant differences you could go over?
We don't prepare their budget for them. That they submit it to us more as a formality. We look at it to make sure that it looks reasonable and that the payments to us are included. But it's more of a formality for us to approve it and make sure it looks reasonable, which we have done.
I'm just thinking year over year, are there big changes?
Looking
Sorry,
at
I haven't looked at it.
Looking at it on the sheet, I don't see any large, other than inflationary costs. I don't see nothing large jumped out to me when we looked at it. I believe Mark looked at it as well. I don't know if you saw anything large that jumped out to you either, Mark.
Okay, thank you.
okay, so you've seen this recommendation. Do I hear a motion?
Motion to approve.
I have a motion to approve
Second.
and a second. Any further discussion? And you will have plenty of time to look at this between now and the commission. If you have any questions, we definitely can bring them up there. Hearing none, call roll, Mark.
Commissioner Gooch? Commissioner Harris?
Yes.
Commissioner Irvin?
Yes.
Commissioner Johnson?
Yes.
Commissioner Piercy?
Yes.
Commissioner Shrino?
Yes.
Commissioner P?
Yes, motion carries. Okay, next is the 2024 proposed budget overview. So welcome to the budget season, guys.
So tonight, I think everybody should have their budget book in front of them. I believe every commissioner got one. It is set up the same as last year. So I'll do a quick walkthrough and then take any questions. But I'll do a quick walkthrough. The first thing I'll do is when you open it, the first page right there, that's just the budget calendar. It is front and back. The front side of that's this committee's meeting calendar. And so that's the nights that this committee will be meeting, and then on the back page of that is the budget calendar as a whole. So as y'all look through that, if you have any questions, let me know. That is also the same calendar that we approved in December. And then as we flip on the next page, you'll see our index or table of contents there. And so if you'll flip to tab 1 is where I'd like to start. You will see there, you probably have to turn your books to the side there. You'll see our statement of proposed operations. This is going to be our budget summary. If y'all remember last year, we went through several iterations of this. But I'll start out by saying the mayor's budget proposal does not propose a tax increase at all. It also proposes moving 2 pennies from the school's general fund budget, as you can see on those far left columns there. That is in conjunction with the schools. We have spoke with them. That has also been passed as part of their budget tonight. I got a text from the school's finance director a few minutes ago that their budget did pass tonight, which is in your book. We already went ahead and included that in your book in anticipation of that passing. But if you look at the tax rate there, we're proposing to move 2 pennies from the general purpose school fund. 1.9 of those would go down to the Fund 177, and 0.001 pennies would go up to the county general fund. I want to make a comment on that very quickly that in years past, we have been reimbursed from the school system for 3 SROs at our alternative schools, but now that SRO funding is shifting to the county general fund, this makes up their portion of that. So it's more of a cleanup to get that into the county general fund and out of Fund 141 now that we're getting the SRO grant. So that's what that is. And then I'll quickly run down through the funds here. So starting at the top is our county general fund. And then we're going to look at the column that says revenues over under appropriations. It's kind of to the right. So that's going to show a deficit of $125,900. That deficit is directly related and tied to opioid money that is appropriated for next year that we received this year. So the county general fund is balanced to 0. We're very pleased with that. But that deficit right there is directly tied to a timing difference of opioid money coming in this budget year and being spent next year. That number will go up depending on, as the opioid committee appropriates more money that they've received this year, they're appropriating some of that for next year. The next fund is the solid waste fund. That fund shows a deficit of $347,000. That one-time reduction of fund balance is due to needing additional cover material or dirt at our landfill. Next fund is Fund 118. That is balanced to 0. So that is balanced, and that does include the rate increases that this body passed tonight. The next fund is our Fund 119 Industrial Economic Development. That is the fund that accounts for the debt for the Smyrna Rutherford County Airport Authority. And then you'll notice it shows a large deficit, but then we put the adjustment column in there for that. That's accounting for the principal payment. That is a balance sheet entry that is not on the income statement for the principal reduction of their bond payment. And then the next 2 funds, 121 and 122, that's the DEA fund and the drug fund. Those both show a deficit, but that's because of the large cases they work and receive money in this fiscal year, and then they spend it in next fiscal year. Then you have the highway fund that is showing a $340,000 surplus. You have Fund 141, the general purpose school fund, which is showing a $5.3 million deficit. However, that deficit is directly related to charter schools. We have to fund charter schools in advance, and so this is directly related to that funding. And we'll talk more about that when we get into the school's budget presentation. The next one is our cafeteria fund.
I want to interrupt for just a moment. One reason that is shown there is anytime you hear these charter schools speak, they say that they're not taking any money from the county. There's $5,378,184 of county money that is going directly to charter schools. So if somebody tells you they're not taking money, come talk to us. Please continue.
Then Fund 143 shows a deficit of $4.6 million, but that is, we have to have a spending plan for any fund balance over 3 months worth of expenditures, or approximately. That is where we have our USDA payments, and they require us to have a spend down plan, and so that's what that is there. 177, the Educational Capital Projects Fund, that fund is balanced to 0. And then our debt service fund, Two things to note there. That shows a $1.1 million deficit. I do not believe we will hit that. However, also, if you remember earlier tonight, Commissioner Irvin asked a question about our school facilities tax. We have reduced that estimate in this fund. Additionally, this body last month appropriated some one-time money for us to pay off our enterprise lease vehicles. We're not going to pay all of those off this year. Those are transitioning. There's a timing difference as far as getting all those titles and everything paid. So some of that will be wrapped up next year. So there's a timing difference there. So even though that does show a $1.1 million deficit, we will not hit that number, but that's what the math shows right now. And then if you'll flip to the next page, that's going to show you our estimated property taxes. Everybody always asks what the penny brings, so there's your penny estimate this year for both county and schools. The next page in your notebook is going to be the list of nonprofit recommendations. So that's that page. Those are in several, I believe, 9 or 10 accounts in the general fund, so we've just summarized the nonprofit recommendations on that page. And then if we get to tab 2 is going to be the positions recommended as part of this budget. And if you'll flip one page, then we give a detailed listing of every position that is recommended as part of the budget. And you'll notice there's 21 new positions recommended for the county general fund and 16 for the solid waste fund.
Do we have this for the schools also?
We do not. The schools will bring their detailed presentation as part of their joint Health and Ed and Budget Committee. However, they are not required to give that to us, but I have asked that they provide some more detail at that committee meeting, and they said they will when they come, but they have not given that to us. The only thing they've given us is their budget summary, which is in your notebook, but their positions they have not given us.
One of the challenges we had last year with the joint meeting was getting 177 that evening, Fund 177 that evening, and I would ask if they would, if possible, provide 177 and position-type data, if possible.
I will ask that. I will definitely make that request on this committee's behalf. But keep in mind, they just voted on their budget tonight.
Thank you.
And so we wanted to have a placeholder in here, a draft of their budget for you. And so as I receive additional information, we'll post it online, or I will bring you inserts for your book. But I'll definitely make that request. The last thing I'll mention are two more things. One, after tab 2, everything is the same as last year. It's in fund order. So everything's the same with revenue expenses. The other thing I would like to mention is that this budget does include a 3.25% pay lift to our table, just like last year. We're trying to keep in line with the raise that county elected officials are giving and with the inflation estimates that the state puts out. So this budget does include that. 3.25% lift to the county pay table is what this includes. That's the same as last year. And that keeps us in line with the raises for the elected officials and the inflation data put out by the state. So this does include that. That's kind of in a nutshell what's in your book in the same order. That's all I have unless there's any questions, and I think the mayor wanted to make a couple statements about the proposal, but that's all I have.
I had a quick question before Mayor starts. The 16 positions for solid waste, I assume that's to man those facilities. Is that going to go to 7 days a week, or is that just going to be?
Some of those are converting from part-time to full-time positions. We've had, and Mary, you'll have to correct me if I'm wrong, but we've had some issues staffing some of the convenience centers and a lot of turnover. And so I believe the mayor's recommendation in Bishop's was to try to help alleviate some of that turnover and staffing issues we've had at the convenience centers. So you'll notice when we get to his budget and his budget presentation, his part-time line item did decrease to offset some of that. And so that was, I think, the reasoning for including converting some of the part-time to full-time.
Thank you.
And then the other position, just while we're talking about that, the other position for that is to help run the new scale house and some new transfer station duties, I believe is the other admin position in there.
Mayor?
The only thing I have to add is that when Michael and I undertook this, just like last year, we started with 4 things. And the premise was this: we want to always have a balanced budget. I think that's physically responsible. So we start with how do we get to a balanced budget. Number 2, how do we take care of our employees? Number 3, how do we take care of our fund balance, which is a direct reflection of our ability to maintain our AAA bond rating? And number 4, how does this budget then impact future budgets going forward? And so the only thing I have to say, gentlemen, is that's the process that Michael and I go through, and we share that process with each of the constitutional officers and the directors so they understand where we're coming from. Balanced budgets, taking care of our employees, maintain our fund balance for a strong AAA bond rating, and to what extent does this budget impact future budgets? And with that, I'll take questions.
I got a question, Mr. Chairman, for the mayor. One of the things, being over the opioid board, is when people come to us and ask us for money, and we had partnerships with Middle Tennessee State University as far as data analytics, and they help us vet these. What I am so against, and I'm sure you are too, is that when we give money to these organizations, which are good organizations, but a lot of the money that we're giving is going towards salaries, and I'm wanting to know if this is something that the mayor could have his chief of staff look at and maybe tell us how much of this money is going towards salary and wages? Or do you understand what I'm saying? Or
let me see if I can phrase it another way so I think I understand. So are you asking what part of this budget growth is going toward new positions?
No, sir. What I'm saying is on the money we give to charities, I'm only talking about that. I'm saying how much of the money that we are awarding them from the county is going towards these programs, just paying for salary and wages for that organization.
Well, I don't have a way to tell you that, Commissioner, to be quite honest with you, because so much of what these social programs provide is salaries for staff to provide those services, especially with opioid, as you're aware of, and so many other services. It's counseling services, and counseling services is a heavy administrative position because you got to have people to provide the counseling. And I don't have an answer for you. I think we can try to find out maybe something, but I don't have an answer for you this evening.
Well, it's not, I don't want to put any undue work on you, but the formula that I have actually answers every one of these questions. And maybe, is that something that maybe the opioid board could get with the mayor's board and then maybe use our resources to help on that? We have an application process. You got to have that anyway to get this money, right?
So all of these, this was governed by state law here where they have to submit a certain application and audit of their records. We won't dole out any of this money until they do all of that, until they submit all of their financials to us. We generally pay most of these quarterly. Now, most of these are, there's a very small section of here that are nonprofits, but they already submit their financials and their audits to us. And I don't know that legally we could put a stipulation like we do the opioid money because it's governed by a little bit different. I don't know that we could say, for example, I'm just using it as random, Special Kids got $6,000 last year. They submit their audit and financials to us, and I don't know that we could tie that to a specific line item in their budget when we dole out the nonprofits. I would have to look into that or get with Nick.
Okay, thank you.
I will say I didn't think I understood your question, Commissioner. You were talking about the charitable organizations, and I think I misunderstood that question. I didn't hear you to say that. So if you were talking about the charitable organization and what is the process by which Michael and I determined what charitable organizations received funding from the county and how much was that funding, I believe, if I'm not mistaken, we limited any increase to 5% or less. I just didn't think it was a good idea to increase that funding beyond the inflation rate or beyond the rate we were willing to take care of our employees. Now, there are some exceptions to that. For an example, the Chamber of Commerce is tied directly to the hotel motel tax, and we don't have any control over that unless you people decide to change the resolution mandating that change. But so there are some things that I'm constrained by, but generally speaking, I've tried to hold the charitable organizations to 5% or less, and we did require them to submit their financials.
Yeah, we're definitely not on the same track. and that organization says Meals on Wheels, all right? I would like to see our money go completely to the Meals on Wheels instead of any salaries or anything like that. Is that something that we can look at to do, or does something need to go through the steering and possibly?
I think I'd like to look at the state law again. I don't have it in front of me to see if we can put that stipulation on it. Maybe I can bring in answer back when we present the nonprofits. I believe that's on May 20th. Maybe I could get with the county attorney and look at it is on May 20th. Maybe bring back an answer on that night, if that's okay, Commissioner?
Yes, absolutely.
Mr. Chairman,
You're recognized, Chairman.
I think some of our donations as a county goes towards some nonprofits, but it's a small part of their budget. So if we're giving $10,000 to a particular nonprofit, the administrator of that nonprofit organization may have a salary of $50,000, which would make it sound really kind of strange depending upon whatever monies we were funding. So we probably could get that information. It may even be on the application process that they make through the state. I'm pretty sure it probably would be. So we could probably get that information. And I'm not sure it's a huge, great big deal, simply because if you look at someone like the United Way as an example, they collect money from hundreds of different companies and organizations that participate in a fairly small part of their annual budgets. So some of those things is kind of hard to determine, but the bottom line of that is, and I think this is what Commissioner Harris is driving at, is that out of every dollar they collect, how much of that dollar goes toward the service that they're providing versus the administration of those funds. And I think that's a big thing for people out in the public who are giving their money to certain organizations. So I understand his question, and I think it's really a valid question. The United Way, as an example, has always made a big deal out of the percentage of money or the cents out of every dollar that goes directly toward the need versus their overhead or administration. So I think that's what he's really asking. Those figures may be available with that application process that they go through with the state and get approved. I think it may be. Anyway, a couple of questions. If I'm not mistaken, throughout this calendar year, there have been a couple of departments that have increased their salaries of employees. And I guess my question is, and we've approved that wholeheartedly, I might add, but when we approved the new salary structure, that salary structure is in place right now, and the increases that we're giving in this budget are on top of those adjustments that we made during the year. Is that correct?
Yes, so we've raised the table 3.25%. I see Sonia back there, so correct me if I'm wrong, Sonia. So part of what we did this budget is try to make sure everybody was on the table. We had 5 to 10 people off the table. So for example, though, to roll a step on the plan, you need to be, I believe it's a year in your current position. But let's say you didn't qualify to roll a step, you would still get the lift to the table. You would still get a lift in that position. So you may not get the full lift if you didn't roll. Like if you only had 1 month in your current position, you're still going to get something, but you're not going to roll to the next step until you complete a year in there. So yes, this would be on top of that. But if you had promoted an employee maybe 6 months ago, they're not going to roll a step. They'll just get the lift to the table.
My concern was if we raised the salary levels of a group of employees in a department and we didn't give them the annual bump, on top of that, we'll be right back in the situation that we were. And I wanted to make sure that that was covered in here.
And we worked, me and Sonia worked really hard together to try to make sure that didn't happen and to try to make sure everybody was on the table. And I think we've done everybody. I'm looking at Sonia. I think everybody now is on the table on a level playing field, and I think we're both really happy with that part of it.
And once again, just to make clear, as we go through this budget process, there are going to be department heads that have budgets in our book here. Will those department heads be presenting their budgets to this committee, or will you be presenting
Each
those?
department head will be scheduled to come, just like last year, on their applicable night. And those departments are denoted on that first page in your book. They start next Tuesday, the 14th. They go Tuesday, the 14th, Wednesday, the 15th, and then Monday, May 20th. And I believe the only change that department head change is the trustee has requested to come on the 20th instead of the 14th. He had a prior engagement. So as far as I've sent this to every department head, so they do know that they should be here on their designated night to present to this committee.
So they'll be standing before us?
That is correct.
Thank you.
I want to clarify one statement, though, that I've heard, and maybe correct me if I'm mistaken, but our fee offices, whoever is elected into those positions, have the ability to set their employees' pay. Now, we provide this lift, which, to my understanding, the budget covers every office. That doesn't mean that a fee officer could not change that and limit some pay or increase others over. So I want to make that clear, and that's out of our control as far as I understand it. But I want to make it clear that as far as I've seen in this budget for that pay, those people are included. Now, that doesn't mean it couldn't be changed by that particular fee officer. Is that correct? Or?
That is correct. We have, the mayor's budget proposal here includes that amount for every department head and fee office, regardless if they follow the county pay table or not. So we wanted to provide that opportunity to that fee official, and just like the chairman said, we do have a few that do not follow the county pay table, but we did not want to penalize those employees just because they don't work for the county. We did want to provide that level playing field, and if that fee officer chooses to deviate from that, then there's nothing we can really do about that.
I might not have made myself clear, and I apologize for that. I understand why they call them fee offices, okay? And that's the exact reason that they do. My question was, if we had a department, and we did, the last couple of months, that came in and adjusted their hourly salaries with some money that they already had left over in their budget. So we're giving increases in our budget on top of the increases that they already gave. And I wanted to make sure that that was correct, simply because if we didn't, that department would be right back in the same position that they were in, which may be hard to fill some of those positions and things. I just wanted to make sure that that's what we were doing.
That is
I thought
correct.
it was, but I wanted to make sure.
Any further discussion on this? If not, we're going to move on to our next topic. Okay, the next topic is the Rutherford Opioid Board recommendations. Michael, you want to walk us
I
through that?
can start
or-
this, and
Mr. Chairman, can we make all these, instead of having three separate motions, just have one motion?
That's fine with me, unless I hear an objection from any of the committee members. I don't personally see any reason to object, but you want to go ahead and state them all first.
okay. So the first thing before you tonight is a budget amendment from the Opioid Board. That budget amendment appropriates money for 6 weeks for $29,193 for the sweet addiction, for the reimbursement of one kitchen manager, kitchen lease, and a specific assistance to individuals with an opioid use disorder. The Opioid Board also approved $50 for our PIO, Lisa Kay, to purchase 3 tabletop T-shirt presentation stands. And then in addition to this, there was a Smart Line. In addition to this budget amendment, there's a Smart Light contract that I believe expired in May, and the Opioid Board did not want there to be a gap in coverage. And so also attached tonight is a Smart Light advertising agreement, which we currently have now. And so that did not require a budget amendment for this year, but we will amend next year's budget to include that, to make sure there's funding for that if this is approved. And then additionally tonight, what you'd be voting on as well is last month, the Opioid Committee intended to fund MTSU again for another year. Tonight, you are seeing the contract related to that. Additionally, as well for next year, the Opioid Board approved $78,411 to Interfaith Dental for FY25. The budget in front of you will be updated to reflect that when we amend that next week.
Okay, you've heard the explanation. Any questions? A couple of us here on that board, so we are fairly qualified to answer most of the questions. If not, I will entertain a motion. Commissioner Piercy.
The sweet addiction reimbursement for the kitchen manager, was that for salary?
Yes, I believe so. What that is a person that's actually teaching some of the people that are enrolled, and at the end of their training, if they're successful, they get a certificate which would allow them to enter the workforce. And there are already employers that are willing to pick these people up if they have that certification. So that's basically what that's doing, is paying for someone to certify these folks. Did I do a good job of?
No, that's fine. Thank you.
Any other questions? Not, let's see. We have a motion and a second. Is that correct?
Could I ask a quick question about MTSU?
Yes, please.
Just a little bit of information about additional data in terms of what they did and what's proposed, if any, and any changes in cost or anything along those lines. I'm just trying to understand.
No, there's no changes in cost. It's the same thing that it was. I believe it's the same, isn't it?
A $900 increase.
$900 difference. But what they do is they vet everybody. They track every dollar that we spend. So we're able to, what I was trying to say with these charitable organizations is try to keep from having just salaries and wages, but going to the programs that actually the money is, meant to go to. So like his question about this sweet addiction it is a teacher who teaches addicted women who know how to cook and give them a trade where they can go out and get a job. So that's where that money is going towards that. I think MTSU has just absolutely been a lifesaver to this organization as far as tracking money. They do tell us, no, we don't want you to give money to this organization, or yes, we advise you to do it. So it's very objective, and it also helps us a lot in finding things out that we normally couldn't.
The other thing I'll add to that too is with MTSU's input there, we don't have to hire somebody to go over these. We don't have to have somebody to vet these, investigate them. We don't have to have somebody that's going to rate them and come to us and say, hey, this one's got this percentile, this one's got this percentile of the different things that we're asking for. And what we're asking for are things that qualify them under the state guidelines on how this money can be spent. So we're actually not having to pay, somebody in-house and give them benefits and all by having this contract with MTSU. And they're also out there looking for more grants for us. So,
thank you.
Any other questions? You say we do not have a motion or a second. Any further discussion? If not, I'll entertain a motion. Have a motion to approve and a second. Commissioner Storino. Any further discussion? Mark, call roll, please.
Commissioner Gooch?
Yes.
Commissioner Harris? Yes. Commissioner Urban?
Yes.
Commissioner Johnson?
Yes.
Commissioner Piercy?
Yes.
Commissioner Srinio?
Yes.
Commissioner P?
Yes. Motion carries. Guys, you've got your schedule out there in front of you starting next Tuesday. We'll be digging into this, but any questions you've got, right now that you've got two people that you can rely on, actually counting our, I want to still say deputy, but a lot of resources here if you have questions. Anyway, that being everything on our agenda, we are adjourned.